So we talked about in higher risk patients when hypomethylating agents fail, but tell me, when other treatments are used, whether for lower risk disease or higher risk, what is the sequence we can consider, and then what should we do when someone does fail?
Sure, no, I think those are all important questions, and we're really trying to personalize these decisions with each patient. So again, we talked about from the very beginning, we try to see, again, what mutations each patient has, and this could really impact any step in our treatment of these patients. So often we consider somewhat of a sequence. So again, if we sort of go from for lower risk patients, our least intensive therapies, again, these ESA therapies, and then we work our way up. Often next can be lenalidomide, then our hypomethylating agents. But really at any time, we strongly consider clinical trial, because although some of these agents have good response rates, we know that basically all patients will eventually progress, and we're really looking to change the natural history of these patients. So even in lower risk patients, let's say who have failed ESAs, we're always considering, do we have a trial? And these strategies differ for our patient population. So for lower risk patients, where again, we think the immune system has a very critical role in the pathogenesis of the disease, and we have multiple investigational agents where we're targeting this. As these patients typically progress to higher risk disease, again, after azacitidine or decitabine, we talk about trials. Again, these can be targeted for the mutations that these patients have, or these cancer cells have come up with very smart abilities on how they're able to survive or progress towards leukemia. And we're starting to have many specific treatments to target those. So I think the bottom line is we think about a trial all the time. We try to give each treatment, if it's working, as long a chance and as durable of a chance for patients to be able to stay on that before we get to next line, and then we keep going subsequently.